My name's Alicia Jaro, and this is the question of the day. Hi, everybody. I've been getting a few questions about sciatica. What is sciatica? Well, let's just say that it's a little bit complicated, so I'm going to try to separate the two. Sciatica is a term that they use to talk about when the sciatic nerve gets aggravated. And when people say sciatica, they are typically telling me, I have pain down my leg. And just because you have pain down your leg doesn't really mean you have sciatica. So let's sort of sift through the difference. So there's two things, well, there's three things, but we're going to talk about the pelvis. And the two things that can give you pain down the leg is either going to be true sciatica, where the muscle in your hip or your butt is really tight and it's pinching on the nerve and the nerve is just shooting. When you have true sciatica, you'll know it because it is a sharp pain that starts and ends, starts in the butt, ends in the foot, and it's just a pain the whole way. There's a straight line, it's not skipping, it's zinging you, okay? That's sciatica. What most people feel when they have, or when they say they have sciatica, is SI joint pain, sacroiliac joint pain. And that can still give you pain all the way down to your toe, but it's not going to hurt in your, you won't be able to feel that line. Your toe's just going to hurt and you're going to go, why the heck is my toe hurting? Ow, ow. It'll throb and you're going to touch your toe and you wiggle your toe and your toe doesn't hurt when you touch it. And you're like, why is my toe hurting? It won't. And sometimes you'll either be laying in bed, it'll just start hurting, or like the side of your knee, the groin, the outside of your hip. There are so many different little spots that you'll feel that SI joint pain. And sometimes you'll actually feel it in the SI joint, in that area at the top of your butt. It's not really your back. Usually people say, well, it's not really my back that hurts, but it's like right here, but they don't know what to call it. That is classic. That's SI joint. When you have SI joint pain, people kind of feel like they're going nuts a little bit because they'll say, well, I mean, it hurts, but then it won't hurt. And then today it hurts on my right side, and then it'll hurt on my left side, because the SI joint, there's two of them, and they're made up by the ring in your pelvis, okay? And where those big elephant ear shaped bones meet your triangle bone, the sacrum, that's your SI joint. And you'll see, if you check yourself out in the mirror and you see some little dimples in the back, that's where it is, okay? And when you shift your weight, you can get some movement in there. And then if you keep doing things that are very asymmetrical, like crossing your legs, like striding out to get into the car with that leg and you stretch it out real bit, sleeping like with one knee way up, anything that is asymmetrical, which most all of us, let's be real, function asymmetrically. We're not perfect. We're not robots. Those things, it makes it less likely that your pelvis comes back when you're resting in neutral to like perfect. And then they'll kind of shift over. And sometimes if you shift your body weight the opposite way, just the pain will shake out on its own. The problem with SI joint pain is when it doesn't shake out on its own and it sticks around there for a long time. The magical thing about SI joint pain is how easy it is to fix. I'll show you at the end of this video how to actually manipulate it. It is so quick and easy. It's something that I do that people are just like, oh my God, you're a miracle worker. And really, we just did a little manipulation. If you think you have sciatica and you treat it like sciatica and you really have SI joint pain, all the stretching in the world is not going to resolve your pain. It might feel good to stretch, and when you have SI joint issues, you do develop muscle asymmetries and tightness in one side and stretchiness in the other. But at the end of the day, the pain is never going to stop shooting down your leg or into your hip if you don't fix the joint problem. And it's frustrating because you'll get to realize that you kind of have to do this little trick kind of all the time because you're kind of always asymmetric. Or you can learn how to live a perfectly perpendicular life which is not going to happen. And I have to get on my hands and knees and crawl around after the kids and do whatever. My SI joint is always sort of cattywampus. I like to say that word because it's kind of a good word to describe the SI joint and the pelvis, cattywampus. We get a little freaked out about this pain, but when it's all said and done, they're easy to treat. And if you understand the difference between sciatica, I have a tight muscle and it's making my leg go off, versus I have a joint problem that if I don't get it taken care of as soon as possible, it's just going to create more muscle tightness. And this, guess what? You could end up with both SI joint issues and sciatica, and that is a bad day. So I will show you a few things in just a second. Okay, as promised, let's fix it. First, we're going to do a little stretch to treat sciatica. Sciatica, if you recall, is when your sciatic nerve is being pinched by a muscle. And the muscle that we're talking about right now is called the piriformis muscle. It's a weird name if you've never heard of it, but Google it. There's lots of good stretches. There's lots of good different positions you can stretch it. Today, I'm just going to show you a seated position because this is something you can do if you're sitting at a restaurant or if you're at home. It doesn't really matter. So what you're going to do is you're going to cross one leg over the other. And you're going to put your foot here, and immediately I feel mine. It's very tight on my left, and you can try both sides and you'll realize that you very likely have one side that's a little bit looser than the other. Okay, so if you sit here and you slouch, you're not going to feel that muscle stretch. You have to sit up on your butt bones, and then just by kind of making this back and forth motion, you can get a really nice dynamic stretch. I say dynamic because when you're walking and doing things, your muscles are constantly being stretched, and so it's a good thing to actually treat them in that way. Instead of just holding it real strong, real aggressive stretch, you are better off doing a nice gentle stretch like this. Or you can take your bottom leg, wiggle it side to side. If that knee wants to pop up, go ahead and let it pop up. And then you can, as you loosen up a little bit, because sometimes this particular stretch can be pretty intense if you've never done it, or if you actually have sciatica and it's just flared up, you don't want to go in hot. You want to kind of ease into these stretches. If this position is too aggressive, you can straighten your bottom leg and just let that other leg do that, and you can kind of wiggle. Or if you don't feel like wiggling your leg for whatever reason, you can kind of rotate your body, and that will also put you in a stretch and kind of let you out of that stretch. Once you warm up a little bit, you can bring it up a little higher. Make sure you're breathing. When you breathe, it sort of helps to relax your muscles and your blood vessels and all those good things. And then you can apply a little bit of extra pressure here. So that's that. The next thing I'm going to show you is how to do the manipulation on the SI joint. Okay, so I have been searching all around the house. I finally found a belt. But the good news is if you can't find belts and you don't have a ball or a pillow, you can still fix yourself wherever you are in whatever position you are, okay? If it's proving to be a challenge to you and you've done this little trick and it's just you walk around and you still having pain, you can try it in all the different positions and it might work laying down better than sitting or vice versa. So first we'll do it in sitting. You're going to take a belt. You are going to wrap it around your knees like so. You don't really have to buckle it. You can just hold it. And the idea is that you're going to open your knee and push against the belt as hard as you possibly can. You want to generate as much muscle force because the muscle is tugging against the bone and it's taking those two bones and sort of distracting them when you do that, okay? You might find it's really, really kind of tender and painful that first time you do it. And as you do it, it'll sort of be a little bit better and a little bit better, but you'll feel the tension in your kind of upper buttock area as you push really hard. So like that's it, a couple times, 2, 3, 4, whatever. And then you can either take a pillow and put it between your knees and give it a really hard squeeze, or let's take a little towel, roll it up. If you had like a volleyball or something like that, you could squeeze it. And this, you're just going to squeeze as hard as you can. You can try doing a wide knee squeeze. You can do a narrow knee squeeze. You can actually take your hands like this and just sort of give yourself a little resistance. You may feel an actual pop in your groin, kind of like when you pop your fingers, which I don't know, that's not the best thing to do. But don't be alarmed. That's a really good thing. That's how you know it kind of shifted back to where it should be, and you should stand right up and feel some relief in whatever pain you were feeling before. You can also lay down, which I'll do real quick if you want to, and you can have, you know, a friend or someone to come over you and give you some manual resistance like this, and then you would push against them. Sometimes that is necessary, and you try to do everything on your own, but you may have an instance where you need a little extra help. So you can lay down here. You're going to push against the belt. You're going to open your knees. You don't want to use a stretchy belt, and you don't want to use like a TheraBand. You want some resistance with this belt, okay? So you do it 2 or 3 times. You grab your little towel, squeeze, and then I just actually adjusted mine. So it did make a difference when I shifted into the position. So try it both ways and you'll get the best outcome. Thanks for watching our video. If you enjoyed what you saw today, go ahead and subscribe to our YouTube channel. If you have more questions, you can put them in the comments section below. If we helped you today, but you feel like there's a little bit more going on and you'd like a one-on-one meeting with either myself or my colleague Bill Clockley, then feel free to email us at info@thetherapycenternr.com. You can call at the number below. You can message us. You can visit our website at www.thetherapycenternr.com. And we really want to be able to help you get through all of your aches and pains at home as much as possible, but that's not always the case, and sometimes people have a lot of specific issues, and it's not always possible to just take general advice, and we get that, and we can certainly help you get through your pains and your aches. So if you live in the state of Louisiana, we can help you with our telehealth sessions. So thanks for watching today, and I hope you have a great day.